We're here at Deuk Spine Institute, Surgery Center Vieira. We're going to be broadcasting live spine surgery done on the lower back of a patient who has a ruptured disc or herniated disc at L5-S1. And she travels to us from Canada, and she's had back pain now for 7 years. 7 years. So lower back pain for 7 years. And she also has what we call sciatica, which is pain shooting down her leg from a nerve root that is being pinched at L5-S1 on the right side. And that sciatica has really been going on for about a year. A little bit less than a year, I think. So she got tired of living in pain, found us on the internet, and came to visit us to get her back fixed. Now, she has what everybody has when they have a herniated disc. She has a tear in the wall of the disc. And that tear is called an annular tear. And when that annular tear is in the back of the disc, called a posterior annular tear, the nuclear material, called the nucleus pulposus, it's a jelly inside the disc, it escapes through the tear, and you get what's called a herniation. Now, a small herniation is called a disc bulge. And something interesting just happened. There was a study that was done recently where they revealed that it doesn't matter if you have a disc bulge or a herniation. So a disc bulge is a small herniation. They still, that the results of surgery and treatment are the same. And it goes along with what I've been saying for years. A disc bulge is a herniation. It's just a small one. All right, so we're going to go in there and repair that tear with a laser. We're going to treat her back and her leg pain. All right, we're going to get started, okay? It's Dr. Deuk here. I'm going to give you a little bit of numbing medicine. There you go. Just relax. Everything's okay. Lay still. You're doing great. So I've just infiltrated her skin, her subcutaneous tissues, to make the procedure less painful. And she's sleeping, but she's in twilight sedation. So even when you're sleeping, if somebody stimulates you in a way that is uncomfortable, you're going to move. Okay? Now, the reason why you see people having surgery at the hospital and not moving at all is because they're chemically paralyzed. Shot? And chemical paralysis is where you give a patient through their vein into their venous system a medicine that actually stops the muscles from moving. We're not doing that with this type of surgery. We don't do chemical paralysis, because if you do chemical paralysis, the patient must be intubated. Shot? And intubation means a tube down their throat. This surgery doesn't require a tube down anyone's throat. Shot? I've got to make my way to the L5-S1 disc. I feel the facet. I'm getting close, but I need to make a small adjustment. Shot? I know she's got family in Canada watching the surgery. And we're happy. We're welcome to take any kind of questions you might have, Shot. But right now, I'm just trying to get down to where the herniated disc is. Shot. And I feel like we're getting awfully close. So you can see on the lateral view, and we use x-rays for navigation as well as localization. X-ray is used for navigation and localization. What's the difference? Localization tells us where we are in the spine. Navigation allows us to navigate or move a surgical instrument from one place to another. And that place that we're moving from is the skin, and our target is the L5-S1 disc herniation. And Jordan has done an amazing job, as always, with making the x-ray as optimal as possible. I think we're off on orbit just a little bit, just the smallest, like 1 degree. Let's see if we can make the orbit 1 degree better. I think that might have made it worse, but I'm not sure. Let's try the other way. Now, 1 degree doesn't seem like a lot. Um, hmm. Hard to say. What am I looking at? I'm looking at the superior articular facet of L5. Can you show that? Yep. And I'm looking at the S1 superior articular facet. Can you show those? See how they're offset? They look like a pair of rabbit's ears. No, no, go to where the tip is. That's one of them. Go, no, no, go, yes, that. And then go to the left. Left, there's another one. Now I want those lined up so I can only see one, not a gap between them. The fact that I can see a gap between them tells me that we're off on the orbit. We're not shooting directly lateral. We're shooting slightly oblique, and we don't want that. Yeah, I'm not sure. It's really hard to tell. But we use the facets. I think that's better. I think that's actually perfect right there. Yeah. So I also look at the back of the L5 vertebral body. Show them that. There's a line there, yep. And I want to see that at the top there, those two little humps at the back corner, show them the humps right there. There's two of them. There's a left and a right. If they're superimposed perfectly, like they are right now, then you've got a true lateral, and that's what we want. Why is it so important to have the best X-ray pictures possible? Well, think about it. You're sticking a needle in someone's spine, and you can't see the spine with your eyes. Can you guys see the spine? I can't. So you have to use a tool, imaging tool, to navigate properly through really a 1 millimeter, sometimes space. And so if we're off on the X-ray picture by a few degrees, you could miss that target, and you could end up putting the needle somewhere it shouldn't be. Because I know I make the surgery look easy if you watch a lot of my surgeries, but the reality is that it's extremely precise. All right, that said, I'm bumping up against the facet. You can see it on the lateral view. I need to go slightly lateral and sneak around that facet. There we go, shot. And now I've done so. All right, you awake? All right, we should be right next to the herniation. Let's get an AP view. Now, also, if you're going to do spine surgery using intraoperative imaging such as a fluoroscope with X-ray images, you want more than one view. You want AP and lateral. That's absolutely perfect positioning. Now, show the audience, Jordan, the L5 pedicle. It's a round thing. It's a round bone. On the right side, correct. Circle it for them. There you go. Show them the S1 pedicle below it. Yeah, yes, there it is. Now draw a line from the mid-pedicle of S1 to the mid-pedicle of L5. Right, and that's right where you're a little bit, it should be a little more lateral than that, just slightly, but it's right where the needle tip is. So the needle tip is right at that line between the mid-pedicle of L5 and S1. That means the disc starts there normally. A normal disc starts there. So we're right at the back of the disc. Are you okay? Don't move. I just need you to answer, but don't move your body around. All right, let's go back to a lateral view. I feel the herniation with the needle. I can actually feel the herniation with the needle. These needles are amazing. We use the same needle every case because the way it's designed and the bore of the needle, the material from which it's made, you know, it slips along. The shaft is perfect. Lay still. Lay still. All right. So I need her awake right now because I'm going to ask her some questions. And I do this for every patient. Big tear. Went in very easy. All right. Are you comfortable?
No pain.
No pain. Good. She's having no pain right now. All right. So we are now inside the L5-S1 disc, and I went through the tear. That's exactly my target. Folks, we're going to show you next week, we're going to release a video from Deuk Spine that's going to show you a laminectomy procedure. We're not doing that today, but laminectomies are what most surgeons offer their patients for this exact problem. But the problem is a laminectomy doesn't fix this problem. but it's still what surgeons offer their patients. It's just, it's like saying, I've got a snake in my kitchen, will you come get it out? And they drop a bomb on your house and blow your house up. That's how they treat the snake. It's like, are you kidding me? Well, the snake's gone, isn't it? No, it's still there. My house is gone, but the snake is still there. The point is that laminectomy is highly destructive surgery. It destroys the normal parts of your spine that don't need to be destroyed. The lamina is not the problem. The problem is the disc. Jordan, show our audience on the x-ray. Let's go to the x-ray real quick. Can you go back to the x-ray, Henry?
Yep.
Show the audience where the lamina is. Yeah, it's all back there. Show them the lamina and the spinous process. Where's the spinous process? Nope, spinous process in the back of the spine. Way back, yeah, there. That's the spinous process. So they're taking that out and the lamina out right there. That's the pedicle. Go back to the lamina in the back. Yeah, that area, they're taking all that stuff back there out when the problem is actually where the needle is. So why do doctors do that? Because they really don't know what they're doing, to be honest, but they feel bad for the patient and they want to help them, so they think that that's at least something. Anyway, when you start taking all the bone and ligament out from a laminectomy, you end up coming back for a fusion. You don't want that. So we are at L5-S1. Are you awake? She okay?
Yes.
All right. Are you comfortable? Good. We're going to put you to sleep in just a minute, okay? How bad is that on a scale of 1 to 10? How bad is that on a scale of 1 to 10?
10.
10. Okay, I'm sorry. We were just testing your disc. We found the bad disc. It was a 10 out of 10. Is that where you typically get your back pain? Yes, so it's concordant. Perfect. That's what we wanted to know. You get to go to sleep now. Can you count from 1 to 100 out loud in Canadian for me? 1. Good. 3. Keep going. You're doing great.
4.
If you get to 100, I'm not paying the anesthesiologist for today, okay? Okay. She's like, okay. Not many people like you. Everyone likes, they're okay. All right, I want to numb the skin up a little more. So she's going to sleep. We woke her up so I could get that answer from her. Why is that answer important? Well, what are we trying to fix here? Back pain and leg pain. The way you fix the leg pain is by basically repairing the annular tear, getting the herniation out of there. The way you fix the back pain is doing the same thing. So the fact that her back pain is coming from that disc is very reassuring that this surgery will fix her. We do a discogram, and that's what that's called, discogram. I'm making a 7mm incision. Okay? And through this 7mm incision, we're going to repair her disc. I'm going to use the x-ray machine to guide me. Shot? The guide wire is there, Luis. Can you see? Can you collimate down a little onto the 5.1 and maybe zoom, magnify? Shot? All right, we've got the guide wire in. I need you to go south just a little bit. Little pressure. Now we've lost 2 drops of blood, okay? That's pretty much all we're going to lose for the whole surgery. Most laminectomies lose about 100 to 200 milliliters of blood, sometimes 500. We're not even going to lose 1 milliliter with this surgery. We're literally going to lose, you need 20 drops to make a milliliter. We're going to lose around 5 drops maximum. So that's 1/4 of a milliliter of blood loss, where everyone else out there is doing massive blood loss for their surgery. Shot? Endoscopic spine surgery, we don't have much blood loss. All right, I feel the herniation. Can you all see the tip of the dilator?
Yes, we do.
All right. I was actually a little generous on the incision. I think I made it a little too big. I made it about 1 millimeter too big. I say that tongue in cheek because a millimeter obviously is not a lot of size, but the typical surgery done with laminectomy, the incision would be measured on inches. Let me see, shot. We're inside the disc. Go ahead. And now we're going to use this dilator that's inside the disc to guide a tube that we're going to do the entire surgery through. Is this tube. This is the endoscopic tube, also known as tubular retractor. Good? All right. Any questions from our audience so far?
No current questions.
Let's show a video on why do herniated discs cause back pain. Everyone knows they cause leg pain, but why do they cause back pain? Most people don't know they're the #1 cause of back pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. And so far we are doing very well here. You can see the laser is the blue fiber, and the tip of the laser is where the energy comes out of the fiber. Let me just clean my lens a little bit because there's some schmutz on it. Looks good. Back in. Now, this type of surgery you're watching is what we call endoscopic, because we're using an endoscope and a very small incision. Endoscopic spine surgery. It's a type of surgery being done all over the world. Unfortunately, the United States is very far behind, so is Canada. And it's really taken off in countries like China and Korea. Unfortunately, it hasn't gained as much traction in the United States, and the reason is because the United States spine industry is controlled by very powerful companies that sell metal implants, and they don't want people getting surgery that doesn't have metal. And this surgery doesn't have metal. So they're more interested in fusions and artificial discs. And patients are more interested in less invasive treatments. We are inside the L5-S1 disc right now. And the blue is the degenerated disc associated with the herniation. Now, normally, the nuclear material is white. Normal nuclear material is white. And This stuff that's blue is not normal. It's abnormal. That's why it's staining blue. It's staining blue because we added a blue stain. And the blue stain only stains herniated disc that's degenerated. The blue stain will not stain bone. It will not stain posterior longitudinal ligament, which is a different type of ligament. It only stains nucleus pulposus that is degenerated. So the blue stuff we want to try to get rid of, not all of it, but the stuff that's stuck in the tear, keeping the tear from healing. All right, any questions?
Yes, we have a question from Cynthia on YouTube,
Hello, Cynthia. Welcome to our live stream.
and they ask, can therapy be set up in the town I live in? It's too far away, and I want my insurance to pay for it. Would this be a problem for you, doctor?
Yeah, Cynthia, great question. You can have therapy wherever you want, but if your therapist does something to ruin your disc after I fixed it, then that's on you. In other words, therapists don't know how to properly treat patients that have endoscopic laser surgery on their discs. So if they do the wrong exercises with you and re-herniate your disc, then you have to assume responsibility for that. That's your choice. I always let patients choose where they want to go, but I tell them I don't recommend going to their therapist because the therapist has never treated a patient with the Deuk laser disc repair. But I don't tell patients they can't go. They can go if they really want to. But I'm not going to be happy if your therapist re-injures your disc by having you do something that you shouldn't be doing. That's the long and short of it. I don't know, Luis, the laser doesn't seem to be performing the way it normally does. It's weird.
You want a different one? Or
Huh?
you want a different one?
I don't know. Are you keeping track of use?
Yeah.
By the way, the yellow stuff at the top is fat. It may surprise some people to know there's fat near their nerves, but think about it. Nerves need energy to work. As a matter of fact, nerves use a lot of energy, and fat is the best way to store energy on a large scale in the human body. And the reason is simple. Fat is hydrophobic, meaning it does not bind to water. Other types of energy that the human body uses, such as intermediate forms of energy like glycogen, glucose, ATP, NADH, FADH2, all of these energy molecules require water to solubilize them, but fat does not. So what is most of the human being? We're water. We're a big bag of solvent, and in that bag of solvent, all these complex biochemical processes occur. But fat is wonderful because it's a low weight, low water storage form of energy. So you don't have to have water, which would add more weight to store energy, right? Dr. Berndes? So fat is actually a very efficient, this is all herniated disc, by the way. Fat is a very efficient energy storage form that doesn't require water and water is heavy. So your body puts fat in areas where, strategically, in areas where it needs it. Now, yeah, there's different types of fat cells, like brown fat, and there's different, I think there's different types of brown fat. There's light brown fat, dark brown fat, and it really has to do with the amount of mitochondria in that area. Again, these are all pieces of herniation, the blue stuff, coming out. You can see the surgery is a combination of laser and grabbing with a pituitary rongeur. More traditional spine surgeries use the pituitary rongeur exclusively, but the laser is necessary for this type of endoscopic surgery because the working area is so small and the laser is extremely small and precise. As a matter of fact, just to give you an idea, this laser is 1 millimeter across, side to side. The inside of this tube is 5.8 millimeters across. So it's a very small area. It looks big because it's a camera that's magnifying and a lens that's magnifying everything. But the reality is this is a very small space we're working in. All right, let's show the video of how the Deuk, did we already do how the Deuk laser disc repair works?
We did the back pain.
We did?
Yes.
All right, any other questions at this time?
Yes, we have a question coming from Lori on YouTube.
Hi, Lori.
And her question is, what is being put into the disc space after removing the current smush he is removing?
Hi, Lori. Great question. We're not putting anything in the disc space because we're not removing anything from the disc space. We're taking the herniation out. The herniation is not in the disc space. It's in the wall of the disc. So we have no intention of removing the normal disc. The laser surgery is removing the herniated disc. A herniated disc is the nuclear material that's left the center of the disc and it's stuck inside the wall of the disc. And this is the wall of the disc right here. And that's what we're treating, is the wall. We get that question quite often. Thanks for asking. So you can see the tear right here in the wall. I'm cleaning the tear with the laser. The Deuk laser disc repair that you're watching is the only surgery in the world that cleans the tear in the wall of the disc. We were the ones who pioneered the treatment here at Deuk Spine Institute. And we're the first to publish it. That was done 10 years ago, almost 11 years ago now. In our first publication on Deuk laser disc repair. You can find that publication in the National Library of Medicine at the United States National Library of Medicine, and it's indexed in what's called PubMed, P-U-B-M-E-D. So if you want to learn more about this surgery done on discs, you can actually go to PubMed and read about it. The articles that we've published are always open access, so they're free to the public. We chose open access journals that are very reputable to publish. Why? Because many scientific journals require that you pay money in order to read their articles. We didn't want people having to pay money. We felt that by having to pay money to read our research and our, she doing all right? Yep. To read everything that it would limit access to that knowledge. I've got probably 5 minutes. Yep. No problem. The success rate of this surgery over the years has been around 95% on average elimination of back pain and 95% elimination of what are called radicular symptoms, which is your leg pain, your weakness, numbness, and tingling in the leg. And that's at 6 years follow-up. We published a study where patients with lumbar disc herniations and annular tears underwent the Deuk laser disc repair, and they had 6 years of follow-up on average, with 95% elimination of their preoperative back pain and leg pain. One thing to keep in mind is that there's 30 different causes of back pain. So the herniated disc is just one. And you have 5 discs in your back, so the herniated disc really account for 5 out of the 30 causes. However, those 5 happen to be the most common of the 30. So about 80%, 85% of your back pain comes from herniated discs. All right, just about done here. You can see the epidural fat right outside the disc, in the back of the disc. You can see the annular tear that I've been working on, cleaning. And we're just about done, probably another 2 minutes, and we'll be done. Any questions for me?
Yes, we have a 2-part question from eClass1 on YouTube.
Sure.
And they asked, do you accept cash payments for this kind of surgery? I was involved in a car accident. Can car insurance pay for this surgery?
Yeah, great question. Thank you. We do accept all payments. We've even been asked if we would take Bitcoin. We said yes. But yes, cash payments are fine. We would need to know which discs we're fixing. Are we fixing 1 disc, 2 discs, 3 discs? And really, it's not up to the patient to identify what discs are causing the symptoms. That's my job. But the patient gets to decide which ones they want to fix. So we never force people to treat all the discs that are causing symptoms. But some people have 2 discs that cause pain. Some people have 3. Some people have 1. This patient has 1. And I would say the average is 2, maybe 2.5 per patient. But yes, we can treat whatever discs need to be treated. And we do take cash payments. So thanks for asking. Just about done here. Just a little fat kind of there. But I don't really see anything more in terms of herniation. Let me just grab in there with the grabber, make sure I'm not missing anything.
We have another question.
Yep,
This-
I'll be happy to take it.
This comes from SL Red on YouTube.
All right, welcome back, SL Red.
And they ask, what are your thoughts on bone marrow injections?
My thoughts on bone marrow injections.
Correct.
Well, they're really, we call them stem cell injections, because what's being taken from the bone marrow, besides a bunch of stuff, is stem cells. So I'm not sure where you live, but in the United States, the bone marrow is harvested to do stem cell injections. They don't work. We do them here at Deuk Spine. They don't work for the disc. They work for other joints, but you know, there's mixed results. You know, does it really last? People don't want treatment that doesn't last. They really want and need treatment that lasts. And the problem in spine is there's so many treatments out there that actually don't last. And the Deuk laser disc repair lasts. So we don't do bone marrow injections because if they do work, they don't last. That said, in our experience, they don't work for a disc herniation. Okay, they may work for your knee, they may work for arthritis in the hips, but they don't work for the disc. All right? They just don't. That's the problem. All right, I'm not really seeing any more. There's a little bit there. We're just about done, doctor. I'm feeling pretty good. She's doing good? All right. I want to make sure we get as much out as we can. Now, some people ask me, Dr. Deuk, do you ever get an MRI afterwards? The answer is no. The reason why is simple. We're not treating an MRI. We're treating a person and their symptoms. The MRI, I can tell you right now, is never going to be normal looking, ever. There's always going to be abnormalities. And the surgery, there is no surgery that makes the MRI look normal. Our goal is to make the patient normal. To get rid of the back pain, to get rid of the leg pain, weakness, numbness, tingling. And this surgery, in my experience, as a neurosurgeon who does all spine surgeries and has done all spine surgeries, this is the very best. It works the best. It's the most effective at eliminating back pain. It's the most effective at eliminating leg symptoms. Whether it's sciatica, numbness, tingling, weakness, any kind of pinched nerve symptom in the neck or back. That's why I recommend this surgery over all other surgeries that we do. And we do all surgeries. All right, we're done.
Lights on, please.
Yeah. Let me just blast this last piece of fat here. Hold on. I just want to look and see if I can see anything. I apologize. I don't really see anything underneath it. And I don't feel anything with the grabber. I feel like we've cleaned it out pretty good. Now it just needs to heal. Healing takes time, by the way. People ask me how long the healing takes. The healing can take up to 12 months. The disc heals very, very slowly. In our experience, the disc takes a minimum of 9 months to completely heal. But the thing about it is your disc will not heal unless you get rid of this herniation. So the only surgery in the world that gets rid of the tear, herniation within the tear, is the Deuk laser disc repair or a fusion. Any more questions?
Yes, we have a couple questions from Cynthia. Two-part question from Cynthia on YouTube. And they asked, do you have online video therapy and will insurance generally cover it? If
No. Yeah, we do not have online video therapy. And I don't know if insurance covers it or not. What other question did she have?
The follow-up was, if insurance doesn't cover it, what are the fees for therapy?
Yeah, Cynthia, we don't provide therapy. We just recommend a therapy group. And it's up to you to engage them and work out the insurance and the payment with them. We don't provide therapy at Deuk Spine. Good. Yep, great question. Therapy is very important after surgery. You want to make sure you get good therapy. You want to get the right therapy. But people ask me about therapy all the time. I tell them I'm not a therapist. I don't know. All I know is that there is one company that does therapy for our patients that has done it for years on the laser surgery patients, and that's Florida Sports and Spinal. And they know what you should and shouldn't be doing. Now, some people can't do the therapy with them, and they do their own home exercises. And we give all of our patients some exercises to do on their own with restrictions.
We have another question.
Sure.
This comes from Leslie Spencer on YouTube.
Hi, Leslie.
And her question is, what does adding pressure on the incision do?
Hey, great question. So I'm adding pressure right now. And Leslie, I'm actually not putting pressure on the incision. The incision is right here. Can you see that?
Yes, we do.
I'm actually putting pressure here. And so what we're putting pressure on is the muscle. Remember, the incision's here, but we went through the muscle to the disc in the middle. And that muscle may or may not bleed a little bit. I don't want it bleeding at all. So by putting about 12 millimeters of mercury pressure down, you're closing off any little veins that might be torn. I don't know if there's a torn vein or not, so I just put pressure on everybody, because that's the only way you can not have any bleeding in the muscle is by putting pressure. So you can see there's no bleeding at all, but I just put a few minutes of pressure just in case there is. I want to make sure it doesn't happen. The reason is when blood gets into the muscle, even a little bit, it breaks down over a few months and it causes irritation of the muscle. And the muscle will spasm a little bit from the irritation. It doesn't do any damage to the muscle, but it just irritates it and causes muscle spasms, which the patients don't like. So by putting pressure on the muscle for a few minutes, you can prevent any of that from happening. I've got a Ray Tech off the field. All right, great questions today. I'm going to take more questions in a few minutes. I'm going to come over to the conference room, our broadcast center, and we're going to answer more questions. So feel free to type them up. But you guys can see tiny incision. Disc has now been repaired. I think she's going to do fantastic. But it will take 9 months to a year for that disc to seal itself off and heal. Okay? All right, I'll be there shortly. Why don't you show them a video comparing the two treatments for disc pain and herniated disc like this that work, which is the fusion versus the Deuk laser disc repair.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Three,
I'm just going back and
two,
looking at more stuff because I have nothing
one.
to do.
Okay, Dr. Deuk here. I was just in the operating room with you performing on this Canadian patient who came to us with a herniated disc at L5-S1 and back pain, leg pain, back pain for about 7 years, and she wanted it fixed. That's really what it came down to. So let's talk about why is it so hard for people to get their back pain fixed? The answers, and there are several of them, are important to understand. The most important reason is that you need to go to a doctor who can make the right diagnosis. What is causing your back pain? And there's this general belief out there that back pain has a cause that is what is called non-focal, or basically the doctor doesn't know. All right, they just call it back pain. And the reality is that back pain has causes, specific causes. But the problem is that the knowledge of those causes is not common knowledge that everyone knows. It's not in a textbook. It's not taught at the universities to doctors or therapists or chiropractors. Honestly, the understanding of back pain and its causes is as varied as the people that treat it. And what I mean by that is chiropractors, for example, understand that what they call subluxation, which is effectively a term of the joints in the spine. They're talking about collapsing of the disc or subluxing or sliding of the facet joints is the cause of pain, all right? And chiropractors believe that their treatments, which are effective in treating certain types of pain, are the treatment, the only treatment. Physical therapists who primarily treat muscle problems believe everything is a muscle pain. Interventional pain management doctors who do needle procedures, they understand that pain can come from facet joints, discs, and various other structures. Spine surgeons have no clue. 99% of spine surgeons have no clue what causes back pain, and therefore they don't treat it. Okay? What every spine surgeon does that I know is they send the patient to pain management. And pain management is essentially pills and shots. And the pain management doctors have a better understanding of the sources of back pain, but only vaguely. They're still not able to localize to a specific joint or two or three or four in a patient exactly where the pain's coming from. So, unfortunately, the truth is in the year 2022, and we're coming to the end of the year, 99.999% of people, when I say people, I mean doctors, therapists, chiropractors, who are doctors, they don't know what causes back pain in patients. So what separates Deuk Spine Institute from other providers is that we do know how to figure out what causes your back pain. And there are 30 causes, common causes of back pain, 30. They include the facet joints, right and left, and there's a facet joint at L5-S1, a right and left, so that's 2. There's facet joints at L4-5, right and left, that's 2. 3-4, 2-3, 1-2, even 12-1, T12L1. So you've got pairs of facet joints, and it could be the right facet joint, it could be the left. And let me show you what I'm talking about. This is a facet joint right here. It's in the back of the spine, and if you count the bones, this is the number 5, 4, 3, 2, 1. These are the lumbar vertebrae. This is the sacrum. And you've got a disc here between each of the vertebral bodies, the big part of the vertebrae. And then you've got a facet joint in the back. So here's 1, 2, 3, 4, 5 causes, plus 5 more on the left and 5 more on the right, which are your 5 facet joints on the left and 5 facet joints on the right. Facet joint there, 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 there. Okay? So already we're at 15. And then you have your SI joints, right and left. You have your piriformis muscles, right and left. You have your coccyx, okay? Then you have your vertebral bodies, which can actually fracture and cause back pain. You have your sacrum, which can fracture and cause back pain. And of course you have tumors and infections, which are very rare, but they can cause back pain. So when you look at all these potential causes of back pain, there's not one doctor that understands all the causes or able to diagnose all the causes. That's where Deuk Spine is really separated itself from everyone else. Because we have interventional pain management, chiropractic, therapy, and surgery, we have combined our understanding of back pain based on these different causes and have now been able to put together for every patient a diagnosis of what's causing that individual person's back pain. Sometimes it requires, of course, testing like an MRI you need on everybody, and sometimes a nerve test. Sometimes we do a diagnostic block where we inject medicine onto the facet joints that numb them up to see whether or not the pain goes away. It's called a diagnostic block. But by using the diagnostic block, the MRI, the nerve test, and the physical exam, we're able to identify the source of back pain 99.999% of the time. Now guess how many cases of fibromyalgia we see at Deuk Spine Institute? 0. Absolutely 0. Why? Because fibromyalgia is a diagnosis that the doctor gives a patient when they have no clue what's causing the pain. And fibromyalgia is a diagnosis that the soft tissues like the skin and subcutaneous tissue are causing the pain. Okay? It's basically when the doctor doesn't know, they say fibromyalgia. All right? So there's all these people going around with fibromyalgia that don't really have fibromyalgia. They have facet pain or disc pain or some other sorts of pain like SI joints or piriformis, but they have a non-fibromyalgia diagnosis that is completely treatable and fixable. So the first step in curing back pain is going to be identifying the source of back pain, which 99.99999% of people cannot do. You need specialized training and understanding, and that's available at Deuk Spine Institute. The second step in curing back pain is going to be to treat the source properly with the best treatment in the world available to get long-lasting, durable results. And that's where the Deuk laser disc repair comes in. It is the treatment of choice for disc problems, which are the most common cause of chronic back pain. They're about 85% of chronic back pain comes from a tear in the back of the disc. Okay? The other most common cause of chronic back pain is the facet joints, spelled F-A-C-E-T. And we have the Deuk plasma rhizotomy now, where we're able to treat the facet joints and permanently eliminate facet pain that comes from arthritis in the facet joints. So we now have 2 treatments that are able to cure 95% of back pain. The other 5% comes from fractures, which are treated with kyphoplasty or surgery. And then there's SI joint, which is injections and therapy, or rhizotomy or fusion if needed. There's piriformis muscles, which is injections with steroid and therapy, or myotomy, where you cut the muscle, or Botox. And then there's coccydynia, which is treated with injections of the coccygeal ligament, or removing the coccyx altogether. So every cause of back pain has a cure, literally a cure, today. And we've had these cures at Deuk Spine Institute now for 20 years. Unfortunately, people don't know about it. And that's really the second biggest reason that there's tens of millions of people, hundreds of millions of people worldwide living with chronic back pain, is that they don't realize there's a cure available, and they don't know where to go to get it. It's one of the reasons we do this broadcast. Now, there are people who are aware of the cure and know where to find it, yet they don't have the insurance coverage to pay for it, or they don't have the financial means. And those people, unfortunately, at this time, are unable to get the cure for their pain because of a different reason, not failure to diagnose and not failure to treat, but they're unable to treat. So those are really the main reasons why people still live with back pain today in the year 2022. Now, we're doing everything we can at Deuk Spine to fix all those reasons. We're spreading the word that there is a way to diagnose the source of back pain. We're spreading the word that there is a fix, a cure for each cause. We're also spreading the word that obviously insurance is a problem for some people, and we're trying to find ways to get the insurance to pay. But understand something, all new technologies that are developed in the world, insurance companies don't want to pay for initially until they're forced to. And it's up to the person who needs the treatment to force their insurance company to pay. All right, so why am I bringing this up? Because I want people to understand that back pain can be cured as long as you have the right diagnosis, you get the right treatment, okay? And we had a comment today from one of our viewers about how they were expected to pay for their surgery and they're not happy about it. Well, I've got news for you, whoever you are. I don't know your real name, but you need to take that up with your insurance company, not with Deuk Spine. Don't penalize us. Don't get angry with Deuk Spine Institute because we can fix your back and your insurance company won't pay for it. That's a problem between you and your insurance company, and you need to take that up with your insurance company, not transfer blame to the wrong person, okay? If I catch my girlfriend sleeping around on me with guys, am I gonna go blame the guys? No. You have to put the blame where it belongs, okay? So stop blaming the wrong person. Blame yourself for having shitty insurance. Blame yourself for not getting your insurance to pay for your surgery. Don't blame the people who came up with the solution to your problem. I'll leave it at that. First question.
First question comes from Cynthia on YouTube,
Hi, Cynthia.
and they ask, you know what that was.
Now, let me just say, I have critics, and you know, they call it the peanut gallery when they throw peanuts at you. In this case, it would be called the hot tamale gallery because I'm getting hot tamales thrown at me by one of my critics. Yes, go ahead. Do I need a catcher's mitt? No cheap shots. All right, Cynthia.
All right. Our first question from Cynthia, the question from Cynthia comes from YouTube.
I'm going to expose you.
Yeah.
You want to be exposed?
No,
Okay.
it's all
so
good.
don't. Go ahead, Cynthia. Let's hear your
Question
question.
is, the sports therapy you recommend, is it only in Melbourne or are there other locations?
So the therapy group that we recommend is in Titusville, Florida, which is north of here, and in Melbourne.
All right, and the next question comes from Rich Hayes on YouTube, and they ask, do degenerated discs regenerate on their own at all?
Hey, Rich. So the question is, do degenerated discs regenerate on their own at all? Absolutely, 100% never. Once you have a degenerated disc, you're going to have a degenerated disc for the rest of your life in the year 2022. That said, degenerated disc is not the problem. Degenerated discs themselves don't cause any symptoms. You can live a completely normal life with a completely 100% degenerated disc. How do I know that? Because I treat patients with them all day long, every day for the last 20 years. So I have hundreds of thousands of patients' experience. And the degenerated disc is not your issue. The problem is the tear in the back of the degenerated disc causing all the pain. And that's what the Deuk laser disc repair procedure targets, is that tear. The Deuk laser disc repair is the only surgery in the world, the only treatment in the world that targets the posterior annular tear, which is the source of back pain, neck pain.
Awesome. And the next question comes from Lori on YouTube, and they ask, do you work in the cervical spine area, C3 through 4 specifically?
Hi, Lori. Absolutely. We work in the cervical spine, the thoracic spine, and the lumbar spine. Herniated discs, no matter where they are generally accessible for this procedure. For the cervical spine, we go through the front. And C3-4 is really the top disc that we treat in the neck. But yes, if you check out our YouTube channel and you look up cervical Deuk laser disc repair, or just type it into Google, you'll see we have videos of actual surgeries done. We do those surgeries every week, and the lumbar surgeries outnumber the cervical. In other words, there are more people in the world suffering with lower back pain than there are with cervical spine problems. I would put it at about 3 to 1. So for every cervical laser surgery we see and do, there's 3 lumbars that we see and do. Just that lower back pain seems to be more prevalent, and people are very motivated to get rid of their lower back pain. I think part of it too is that people with cervical disc herniations, maybe they're just not aware that there are treatments available for those herniated discs. So to answer your question, 100% C3-4, not a problem. We could do a Deuk laser disc repair to fix that. Just check it out on Google and you'll see it. Surgery takes about 30 minutes to do. It's done with a 4mm incision, like literally 4 millimeters. It's like nothing. And it's outpatient. And you basically go home an hour after your surgery.
Next question comes from Ray Garcia on YouTube, and they asked, have you considered fixing your back?
Ray Garcia. Very funny. Have I considered fixing my back? I didn't know I have a back problem. It's actually my hip that hurts. And probably like everybody else, I make the same mistakes. Doctors are terrible patients, by the way, in case you didn't know. I just put it off until it gets to the point I can't put it off anymore. But I don't have a back problem that I'm aware of, unless you know something I don't know.
And these next questions come from Brad Adams on YouTube. And they ask, so how long does it take for the disc to heal or you to return to normal activities without worrying about re-injuring the disc? You mentioned if a PT person is not familiar with your surgery, they can choose the wrong rehab. So will it be 100% or are you limited to what you can do forever?
Yeah, so the problem with a herniated disc is that there's a wall around the disc that's very strong. It holds the jelly in the center. When you get a tear in the back wall from an accident, some type of an injury, now the jelly can escape into the tear and get stuck in there. So what I do with the laser surgery is I come in with the laser and I literally clean out the jelly that's stuck in the tear. What that allows is your disc to naturally reseal itself. The problem is that resealing process takes probably about 9 months to a year right now. So for the first 9 months, let's just say a year after the surgery, I tell all my patients 12 months. They need to wait 12 months before they resume normal full activities. And the disc will heal as long as you don't re-injure it during that time. So during the first year, the disc is vulnerable to re-injury, susceptible to re-injury with certain types of activities. Those are anything that involves bending over, picking things up from the ground if you're having lower back surgery, for example, or carrying anything more than 40 pounds, okay? So you want to limit the amount of weight you carry. You want to not bend over and pick things up from the ground. As long as you do those 2 things, and the bending is for 3 months, and the 40 pounds is for the first year. As long as you do those 2 things, then your disc will literally reseal and go back to being normal. Okay? The disc reseals, it heals itself because we've given it the ability to heal itself. That tear with the herniation of jelly stuck inside the tear is blocking the wall from resealing. It literally is blocking it. And your wall will never, ever, ever reseal on its own. Because every time the wall tries to seal itself, it hits the jelly, and the jelly is basically not allowing the collagen fibers to mesh together, okay? And what my surgery does, basically it cleans out the jelly and it lets the fibers heal. Give me a second. Hey, Julie. Hey, he is. Sure. All right, bye. Sorry about that. So you will heal your disc if you give it the right conditions, environment to heal, and avoid certain activities. So the therapy group that we've used for the last 16 years to treat patients with this surgery, they have all that experience for 16 years of treating these patients. So I know they do virtual consultations, I know they do in-person consultations, but aside from that, making those arrangements is up to the patient. We don't handle that. We're not involved.
And that is it?
All right. Well, I hope you enjoyed our one surgery for today. I'm going to go check on the patient in a few minutes, and we'll be sending her back to her hotel. She'll come in for a quick visit tomorrow and then head back to Canada probably tomorrow afternoon. Hope you enjoyed, and we'll be back on Thursday.